days when we're having as much fun as this because there was no COVID-19. Obia Branta, you could just go around your business, marrying, making merry and all that. But times have so changed, and it's time again to talk about something that has affected the entire world. And right here in Ghana, we are battling with a third wave of COVID-19. Now, we've been told that this third wave may actually be the worst one because as at now, these are the figures we are seeing right now. Now, in the first 2 weeks of July alone, we have recorded more cases of 144 than in the whole month of June, which recorded a total case of 100 COVID-19 cases. Now, this third wave is actually scarier because more prevalent is the new variant, Delta variant, in all the cases that we are reporting. These are hard times. These are difficult times, and there are so many questions lingering on the minds of people that must be answered this morning. We have the right resource person in the studio, but before I even get to him, this is the situation as at when COVID-19 broke in the country. Confirmed total cases 97,728. 94,612 recoveries, 802 deaths, and unfortunately now we have active cases of 2,314 currently in the country. Greater Accra is still the hotspot, Ashanti region, Western region, Eastern region, Central, followed by Volta region. And that's the situation currently. Let me see if I can fetch exactly. So this is what our picture is looking like at the moment. Total active cases 2,314. Now this is the breakdown. So if you're talking about routine surveillance, in total we have tested 326,000 people, and out of that, 34,100 cases were positive, and then 478 for enhanced contact tracing, out of which 61,669 people were tested positive. Now, at the airport for international travelers, we've tested a total of 354,742, out of which 1,959 have tested positive. Now, so this is the total tests that we have taken in this country, 1.332546 currently, and this is what our picture is looking like right now. Bear in mind, or put that figure in mind, 2,314 active cases. And like I mentioned before, okay, so let me just go back to my table quickly. Like I mentioned before, in July alone, in the first 2 weeks of July alone, we have seen more cases than we saw in the month of June. Now, there was a news item right here on News 360 that I want us to take a look at before we get into the conversation. Let's take a look.
If you look at the data,
so whilst my team work on getting that news item for me, quite a number of items making the rounds this morning. But Dr. Emmanuel Amankra, okay, so that news item is ready. Let's take it and then I'll come back to Dr. Emmanuel Amankra.
Between 4th of July and on the 12th of July, on the 4th of July, it was around 1,573. And on the 12th of July, it was around 2,247 confirmed cases. This is quite alarming. The experts say that the only possible way where we can have the effect of COVID-19 reduced is when we do mass vaccination. And as I speak to you, we have vaccinated around 1 million people. So the answer should be vaccination, vaccination, vaccination. As I stand here as a ranking member on Parliamentary Select Committee on Health, if you ask me when we are going to roll out the next vaccination plan, the answer is I don't know. I don't know. And the worst of it all is that we have stopped doing testing. Now, if you have a positive case, it takes you, the patient, to go and test your relatives. There's no government plan for testing. Now, laboratories are charging between 360 Ghana cedis to 600 Ghana cedis. Now, government facilities have run out of reagents even to do testing. Now, hospitals are full up, and you know. So, the earlier we take decisions in order to save the good people of this country, the better it will be for all of us.
All right, so that was Mr. Kwabena Mintah Akando, who is on the Parliamentary Health Committee in Parliament. And to add to what he said, now Dr. Joseph Oliver Kome, the acting director of Ghana's Infectious Disease Center, explained that the intensive care unit ICU for critical COVID-19 patients is full. And the ward for severe cases is also filled to capacity and can no longer admit new patients due to inadequate oxygen and stuff. Now, he says that the only reason why you can take patients into your ICU is when you have oxygen and adequate staff to handle them. At the moment, we are constrained a little by oxygen, and it is not only the Infectious Disease Center. Almost all the ICU centers are constrained by oxygen, including the use of high-flow oxygen, very expensive, that patients cannot afford. We are in a very bad place, if you ask me. But to make sense of all of this, Dr. Emmanuel Amankwa, lead clinician, LECMA Isolation Center, is here with me this morning for us to see what the way forward can be for our country. Because currently, it's just about 4.8% of the targeted group of 20 million people who have been vaccinated, and that's just around 1.2 million people who have been vaccinated so far. And in the beginning, we were told that by October, a total of 20 million people must be vaccinated so we can get herd immunity. But we are in July, approaching August, and it's just about 1.2 million people who have been vaccinated. Dr. Mankwa, the first question lingering on my mind this morning is, are we underreporting even? Is this the actual truth?
Good morning, Cookie, and good morning to your viewers as well. I believe that the figures there are what the testing is coming up with. But then the question is, what about those who are not testing?
Exactly.
Those who are not going to the hospitals.
Are
those
we
are not
under
going to
testing
the
at the
facilities.
moment?
So now, what the testing is, you come to the hospital and you're tested. We don't go into the community to test them because of the phase of where the pandemic is, following the public health guidelines. Now we're not going searching because we already have community spread. So we increase our surveillance in the facilities. You tell people once you have any symptoms, come to the facilities and test. And then the test is still free in public facilities. It's still free in public facilities where it was being done, so you can still get tested. And we encourage people to get tested. And the news item you read from the acting director for the Ghana Infectious Disease Center is actually the picture that cuts across all treatment centers.
As of
now. Because places are filling up. So beds for severely ill patients are filling up. And then as of now, most ICUs for COVID patients are filled up. Let's have in mind that in total, we have few ICU beds in general. Then ICU beds for COVID patients, even fewer. And then they are filled up. Now, if you're to go to the private facilities, how many people can actually even afford
And he even mentioned
to go there?
Yeah.
And the average Ghanaian cannot afford to go there. And things are a bit hard in the system now. People are complaining of financial constraint. So it's a huge problem because the third wave is here. We are not talking about is the third wave beginning. The third wave
is actually here.
It started. For myself, for example, I think from 1st July till now, we've had 22 cases test positive.
At LECMA?
Yes. And out of that, 15 was from just last week.
No way.
And 7 from 1st of July. So the cases are going up. More severe cases are going up. less people have been vaccinated. Like you said, we're less than 5% of the population have been vaccinated.
Yes.
Yet still, people are living like we've had 50 or 60% vaccinated because people are not following the guidelines.
Okay, so then the next question that the layman on the streets would want to ask is, what is causing this? You know, when we had the surge in January, February, many people attributed it to Christmas, election time, and everything. So at this moment, where we haven't seen a lot of celebration, there hasn't been elections or anything, what is the actual cause of this surge?
No, so we haven't seen a major celebration, but things are going on. People let their guards down because people were not following the guidelines. A lot of people thought we were done with COVID. So a few months ago, you see people not really giving the needed attention.
Are we ignoring the protocols?
Yes. A lot of people are ignoring the protocols. Even as I'm on my way to the studio, you could count the number of people who are wearing masks. It's few. And it's sad because at this point in time, we are in a critical state.
Wow. Wow. Now, the other question I would want to ask is, so if ICU centers are getting filled up, more and more people are reporting at the hospitals, and we are actually all witnesses to the fact that we have let our guards down and all that, and it's being projected that this would be worse than all the surges that we have had. What's going to happen? Where are we headed? Now, there was a question I wanted to ask you, because when these patients come to the hospital, I believe that you ask them questions, where they have been, what they did, and all that. Now, there's something interesting that came up because Dr. Anthony Nsiasari says he's the presidential advisor on health. Now, he's saying that most of the cases that have come in already are not cases that have been reported from funerals. But these are cases that have been reported from merrymaking and partying and all that. Is that the actual situation you're experiencing in the hospitals when people come?
Well,
from the data that you gather?
I think it will be quite difficult to say that no one got at funerals, because here are cases, we see images of people flouting these regulations and protocols at funerals. And it's about not putting on your mask, not socially distancing, not using hand sanitizers. So it will be quite difficult for you to say outright that it's not from funerals. But then, once people are flouting these protocols, definitely it can be a source.
Wow. All right. Now, the next question I want to ask is, vaccination was the way forward. That was what would have solved this problem somewhat or to a larger extent. Now that we haven't attained herd immunity, what can we do to save our lives since the numbers are just going up? I'm very sad this morning because I'm even scared for my life. Fortunately for me, I've had a double dose already. About 300,000 people have had just one. We are in the second week of July, and the people who've had one had it from the latter part of June. They are 2 weeks into it already. And then it's expected that by the 8th week or by the 12th week maximum, you should have been vaccinated. So now that the vaccines are not here, what can we do?
So what we can do is that people have to make sure that they are obeying the protocols. You have to make sure you're protecting yourself.
But here's the case where people are clearly not obeying it. What can we do to even help you, the health practitioners? What can be done? What's government surveillance even doing? Because the last time that we saw that shooting in Idra, the military men actually arrived in a COVID-19 safety van. These vans are actually supposed to be going around making sure that people are not ending up partying, people are not gathering, and people are just adhering to all these protocols. People are not even wearing their masks on the streets anymore. What can we do to help? Because the situation is getting out of hands. Are people tired?
So I believe we are due for an address by the president.
Overdue, actually.
I think, yeah, overdue.
Yeah.
It's way overdue. We had fellow Ghanaians that come into your house to talk to people, for people to actually understand that the situation is quite dire. Because I believe some people still think it's not really that serious because they don't see it. It's quite unfortunate when you realize that when it's your relative who can't breathe and your relative comes to the hospital and you had to tell some relative your relative had COVID. She was crying. How? But then that is it. So we are getting to the point, the beds are getting full, health workers are getting overworked because the staff strength is also low.
Yeah.
And then we don't have a lot of ICU specialists as well. So all these factors are fighting against us. And if the people are not ready to also protect themselves, because if you get positive and you get the severe forms, government may not be able to help you. We may not be able to help you. Then what next? What if there's no bed? What if there's no oxygen for you? Because oxygen requirement is one major thing for COVID. Someone can use about 3 cylinders of the large oxygen in a day.
One patient?
Yes.
One patient?
One patient can use that in a day, and the person will be on oxygen for about 2 weeks or more. So imagine. So
that's 12 cylinders or maybe 14 cylinders for just 2 weeks for one person?
For one person. So imagine if the oxygen, and oxygen is very expensive. It's very expensive. You pay per hour. And so appreciate that you can breathe now as you're watching us, and make sure that you obey the protocols. Make sure that you have to wear your mask, wash your hand sanitizers, because a 1 cedi mask may prevent you from paying huge amount of money for oxygen.
I want to look at the issue of a lockdown at the moment. You know, when COVID-19 started in 2020, we've had 2 rounds of restrictions. The first one actually limiting social gatherings and funerals to 25. And then later on, it was relaxed a little bit, and then we could have 100. But that's not the situation that we are seeing at the moment. You've mentioned we've seen funerals, we've seen football matches, we've seen parties going on, and actually private parties that do not even make it to TV or even to social media. There are things that are happening in the country. Are we headed for a lockdown, do you think? Or do you think that will solve the situation? Because yesterday, Dr. Kuma Boaji was speaking, and he said we're expecting 1.2 million doses of Pfizer. But that is not coming anytime soon. It is coming somewhere in August. We are now in the 2nd week of July. So before we get all those vaccines, what do you think we can do apart from observing the protocols? Are we headed for a lockdown? Should we consider it?
So I think at this point, a lockdown may still be premature, like I said last week, because there's also some economical implications of a lockdown for the average person or the average Ghanaian. And these complications or other side of it force people to actually flout the rules.
Yeah.
So I think what we should do is to strengthen what is there, increase restrictions. Basically, if you're able to put down restrictions and enforce the following of these restrictions, I believe that it will go a long way to help reduce the spread. Because basically now it's all about people still spreading it and taking it out there. And the severe cases are becoming too much.
How bad is this Delta variant out there?
So
what's the percentage right now that we are looking at?
So the Delta variant is expected, or is seen to be one of the most dangerous, more than the Alpha and then the Wuhan variant that we know.
We've had, yeah.
And more severe cases. We have younger people. I think this week I've been talking to someone who's like 30-something, who are having severe cases. And it's quite serious, and the symptoms are not classical.
That's what I wanted to ask. That what does it look like for the older variants? We know exactly, or we've tested, or we've even seen friends and family experiences, so you can have an idea. But this Delta variant, what does it look like when it starts? How do you even know?
So it starts usually cough associated, respiratory signs come up, and then one thing we've realized is people can have diarrhea associated with it, gastrointestinal signs, as we call it. So some diarrhea, and then they get weak, and then you check the oxygen saturation, and the person's oxygen saturation is low. Because having diarrhea shouldn't cause the oxygen saturation to go low. So that, as well as the classical flu-like symptoms. So if you're watching this, as soon as you experience all these things, feel free to go to the hospital and be checked. It's going to help for you to be diagnosed early to prevent complications or you moving from moderate to severe form.
And normally the older ones, the older variants that we know that you have or has an active lifespan. Let me say, before it starts to take effect, is between 2 and 14 days. Is it the same for Delta?
Yes, from after 7 days, you can start showing symptoms. So after a week, you can start showing symptoms.
Wow. Now, there's been a communique that I want to read quickly from AstraZeneca, and it's coming from the Africa Director for AstraZeneca, Barbara Neal, And she is saying that COVAX is ready to roll out vaccines into Africa, but it's going to be later on this year. So we are expecting about 1.6 billion vaccines into Africa. And I want to believe that's the reason why Dr. Kuma Boaje is also saying that we are expecting some vaccines in the middle of August to get to us in this country. But in the meantime, we do not have the vaccines yet. So all that we are left with is just to follow the protocols. I'm a bit down this morning because the numbers that we are seeing, and I'm getting phone calls already, people asking, family members asking if you know doctors or even if you know private places that can admit people. The situation out there is very dire. What will be your last words to the people? But even before your last words, what's happening in the hospitals? You have enough PPEs as doctors and health practitioners. Are you okay to even contain the situation?
So as of now, PPEs are available, but then worker fatigue comes in. When the cases become too much, you become overwhelmed with the cases, and the cases are going up. We are not seeing a plateauing of the cases, but we are either seeing an increase of the cases. So everyone is scared. Even on social media, health workers are always putting out there, our COVID ward is full, our COVID ICU is full. People should just obey the guidelines, but people are still not hearing. People are still not following it and still going about their usual work. So I believe that it's time we talked more about it for we, the health workers, as well as the media as well, giving the information out. And then I think government should also come out to let people know that things are not as cool as they seem. We are heading to a crisis. If I say we are not,
we are in crisis actually, because like you rightly said, the third wave is here.
Yes.
It's not that it's about to come; it is here, and you may want to take all the precautionary measures. We cannot say it enough. Do not stop wearing your masks out there. You need it on as long as you are outside. Keep washing your hands. Keep sanitizing your hands as well. The vaccines are not here yet. The targeted group of 20 million, out of the 20 million, is only 1.2 million people who have been vaccinated, and most of these people have received just even one dose. What about the rest of the populace who have never even seen a vaccine in their lives? You may want to be careful. Stop saying that you don't believe in COVID-19, and until you see people die, you will not believe. You've seen people die in the past. People, prominent people in society, including Sir John, have all died out of COVID-19, and this Delta variant is not one to be toyed with. So you may want to be very, very careful out there. Protect yourselves, protect your families, so that we can protect the nation at large. Dr. Emmanuel Amankra, he's the lead clinician at Lekma Isolation Center. Thank you so much. Are you going back to the hospital?
Yes.
And you're expecting more cases today?
I already have 6 or 7 severe cases on admission
this
today.
Morning?
Yes, yes.
Be advised. This is still TV3 New Day. We'll be right back with more.